71-year-old man died in his sleep. 4 bedtime habits you must avoid after 70. It is a stark reality that as we age, our bodies undergo significant changes, and what may have been perfectly acceptable habits in our younger years can, after the age of 70, become silent threats to our well-being. The story of a 71-year-old gentleman who tragically passed away in his sleep serves as a somber reminder of this. He appeared healthy and lived a seemingly ordinary life, enjoying a regular evening just like any other day, only to never wake up the next morning. This unfortunate event raises critical questions. What happened, and could it have been prevented? The unfortunate truth is that certain bedtime routines, seemingly innocuous, can silently compromise our health, escalating the risk of serious medical emergencies such as strokes, heart attacks, and even sudden, unexpected death. The most concerning aspect is that a vast majority of individuals, particularly seniors, remain unaware that they are inadvertently engaging in these detrimental habits. This video delves into 4 specific nighttime practices that individuals over 70 absolutely must avoid. These are not drastic lifestyle overhauls, but rather small, seemingly harmless routines that can exert a profound influence on one's health and longevity. Some of these may come as a complete surprise, while others might be activities you've performed for years without a second thought. By the conclusion of this discussion, you will be equipped with the essential knowledge to safeguard yourself, enhance the quality of your sleep, and awaken each morning feeling revitalized and in better health. We urge you to stay with us until the very end, as the final habit discussed is something that many seniors unknowingly practice every single night, potentially placing them in grave danger. Furthermore, you will discover practical and safer alternatives to ensure a healthier and more secure sleep. Let us begin our exploration. One of the most prevalent yet remarkably dangerous bedtime habits for individuals over 70 is the consumption of heavy meals too close to bedtime. While you might perceive this as a minor indulgence, perhaps a practice you've maintained for years without any apparent negative repercussions, the reality is that as our bodies age, their ability to process food undergoes a significant transformation. The timing and nature of what you consume before retiring for the night can critically affect not only the quality of your sleep, but also your cardiovascular health, and, more alarmingly, your susceptibility to sudden nighttime complications. Consider your younger years. It's likely you could have enjoyed a substantial dinner late in the evening and still experienced sound sleep. However, post-70, your metabolism naturally slows down, your digestive system becomes less efficient, and the process of breaking down food takes considerably longer. This digestive sluggishness can manifest as uncomfortable acid reflux, disrupted sleep patterns, and even elevated blood pressure, all of which are established precursors to a higher risk of experiencing heart attacks and strokes during sleep. If you've ever been jolted awake in the dead of night by the sensation of heartburn, an unsettling discomfort, or a racing heart, it's highly probable that your late-night eating habits are the underlying culprit. When you consume a large meal immediately before lying down, instead of your body dedicating its energy to deep restorative sleep, it becomes intensely occupied with the arduous task of digestion. Your stomach churns, producing a greater amount of acid. Your intestines work overtime, and your heart rate remains elevated when it should naturally be decelerating. This creates a cascade effect within your system, keeping you in a lighter, more restless sleep state and thereby increasing the likelihood of sudden cardiovascular events. For illustrative purposes, envision indulging in a late-night snack, perhaps a rich pasta dish or a greasy burger, just before heading to bed. While you might feel replete and satisfied in the moment, as soon as you recline, your body struggles to maintain adequate control over stomach acid. This acid can then ascend into your esophagus, inducing discomfort, coughing, or even alarming sensations of choking, that can forcefully awaken you. Over an extended period, chronic acid reflux, also recognized as GERD, gastroesophageal reflux disease, can weaken the musculature of your throat and airway, thereby elevating the risk of aspiration pneumonia, a severe lung infection that can prove fatal for seniors. Even more concerning, consuming meals too late in the evening can contribute to sharp fluctuations in blood sugar levels. If you have diabetes or are predisposed to it, this habit can lead to glucose imbalances, making it considerably more challenging for your body to regulate blood sugar effectively throughout the night. Scientific studies have indicated that seniors who habitually dine late at night exhibit a statistically higher propensity for developing metabolic disorders that are strongly linked to heart disease. So, what constitutes a healthier alternative? We advocate for concluding your final meal at least 3 to 4 hours prior to your intended bedtime. This temporal gap provides your body with ample opportunity to complete the digestive process adequately before you assume a horizontal position. Should you experience hunger pangs before sleep, opt for a light and easily digestible snack, such as a small handful of nuts, a piece of fruit, or a warm cup of herbal tea. These judicious choices can actively promote better sleep without imposing undue stress on your digestive system. It is imperative to remember that your body functions differently now compared to decades past. By implementing this straightforward adjustment to your eating schedule, you can significantly mitigate your risk of nocturnal health complications, profoundly enhance your sleep quality, and provide your body with the much-needed rest it genuinely requires. The notion of staying well hydrated is universally acknowledged as beneficial, and indeed, it generally holds true. However, when it comes to fluid intake, particularly in the hours preceding bedtime, excessive consumption can, paradoxically, prove detrimental, especially as one enters their senior years. If you are over the age of 70 and find yourself repeatedly waking during the night to visit the bathroom, it might be a prudent time to reassess your evening fluid intake. Beyond the obvious disruption to sleep, this habit can also contribute to an increased risk of falls, cardiac issues, and, over time, even cognitive decline. The underlying reasons for this are significant. As the aging process progresses, the bladder naturally loses some of its capacity and efficiency in retaining urine for extended periods. The supporting muscles can weaken, and your kidneys continue their essential filtering process throughout the night. Furthermore, your body becomes more sensitive to even relatively small amounts of fluid within the system. Consequently, if you imbibe a large glass of water, tea, or juice shortly before retiring, you are far more likely to be awakened by an urgent need to urinate. While this might initially appear as a minor inconvenience, the potential consequences can be far more serious than one might initially assume. Picture this scenario. It's the middle of the night, and you suddenly awaken with a full bladder. In your haste to exit the bed, your blood pressure, which has had time to adjust during sleep, may drop suddenly. This can lead to a condition known as postural hypotension, characterized by a sharp decrease in blood pressure upon standing, which can induce dizziness, lightheadedness, and, in severe cases, fainting. Many seniors experience this phenomenon without fully comprehending its cause, and tragically, it stands as one of the most common precipitating factors for dangerous nighttime falls. A simple trip to the bathroom can, therefore, escalate into a life-threatening accident, resulting in fractures, head injuries, or worse. Beyond the immediate risk of falls, frequent nighttime urination, medically termed nocturia, can profoundly disrupt your natural sleep cycle. Each time you awaken, turn on a light, and engage in activity, your brain can become confused, perceiving it as the onset of morning. This disruption interferes with the body's natural production of melatonin, the crucial hormone responsible for regulating deep, restorative sleep. Over an extended period, chronic sleep deprivation resulting from such awakenings can weaken your immune system, elevate your blood pressure, and even accelerate cognitive decline. Scientific research has provided evidence suggesting that seniors who experience frequent nighttime awakenings are at a higher risk of developing dementia and other memory-related conditions largely attributable to the long-term impact of sleep disruption. However, it is essential to emphasize that maintaining adequate hydration remains vital. The optimal solution, therefore, lies in adjusting your fluid intake schedule rather than eliminating liquids altogether. Aim to consume the majority of your fluids earlier in the day, gradually tapering off by late afternoon. If you feel thirsty in the evening, opt for small sips rather than drinking an entire glass of liquid. Additionally, be mindful of caffeinated beverages, such as coffee or tea, consumed in the late afternoon, as caffeine acts as a diuretic, increasing urine production and potentially exacerbating the problem. Another valuable tip is to pay attention to less obvious sources of fluid within your diet, including soups, fruits with high water content, and even certain medications, all of which can contribute to fluid retention and increase your likelihood of waking during the night. By making these small yet intentional adjustments to your fluid consumption patterns, you can dramatically improve the quality of your sleep, significantly reduce your risk of nighttime falls, and bolster your overall health in the long term. If you are still engaged with this video and find the information presented to be valuable, please signify your presence by commenting number 2 below. Furthermore, if you have not yet subscribed to our channel, we highly recommend doing so and activating the notification bell to ensure you do not miss any future informative content. Your support is instrumental in enabling us to continue producing high-quality material that informs and inspires our audience. Now, let us proceed to the next critical point. While the idea of a cozy, warm bedroom might initially sound inviting for individuals over the age of 70, maintaining an excessively warm sleeping environment can subtly jeopardize their health. Many seniors unfortunately err by increasing the thermostat settings or layering themselves with heavy blankets, believing this will induce better sleep. However, the reality is that sleeping in an overly warm room can elevate your risk of cardiovascular problems, dehydration, and diminished sleep quality, often without your conscious awareness. As we age, our body's thermoregulation mechanisms become less efficient. The capacity to sweat and release heat diminishes, making it easier for our core body temperature to rise to unhealthy levels, particularly during sleep. When your body overheats, your heart must exert greater effort to cool you down, placing undue strain on your cardiovascular system. This can be particularly perilous for seniors who have pre-existing heart conditions, high blood pressure, or circulatory issues. Have you ever experienced waking up in the middle of the night feeling excessively sweaty, restless, or even slightly breathless? This is a telltale sign that your body is struggling to regulate its temperature. Scientific studies have demonstrated a direct correlation between sleeping in a warm environment and an increased risk of dehydration, even if you don't feel overtly thirsty. Mild dehydration during the night can lead to thicker blood, thereby increasing the potential for blood clots, heart attacks, and strokes, especially in older adults. Let us consider a hypothetical scenario involving Frank, a 74-year-old retiree who enjoys reading in bed before retiring. He maintains his bedroom at a comfortable 75-degree and piles on thick blankets for warmth. Night after night, however, he finds himself tossing and turning, waking up drenched in sweat and feeling groggy the following morning. What Frank is unaware of is that his warm sleeping environment is actively disrupting his body's natural sleep cycle, preventing him from achieving the deep, restorative sleep stages essential for optimal health. Conversely, a cooler sleeping environment facilitates better sleep by encouraging the body to naturally lower its core temperature. This process is indispensable for deep sleep, which plays a vital role in memory consolidation, immune system function, and overall longevity. Seniors who consistently sleep in cooler environments report feeling more refreshed, energized, and mentally sharp upon waking. So, what is considered the ideal sleeping temperature? Experts generally recommend maintaining your bedroom temperature between 60 degrees Fahrenheit and 67 degrees Fahrenheit for optimal sleep quality. If this range feels too cool, consider using breathable cotton blankets rather than heavy synthetic ones that can trap heat. Wearing light, moisture-wicking sleepwear can also aid in regulating body temperature throughout the night. Another simple yet effective strategy is to open a window for fresh air or utilize a small fan to promote air circulation. Not only does this assist with cooling, but it also enhances air quality, thereby reducing the risk of respiratory issues that can disturb sleep. Implementing this minor adjustment to your sleeping environment can yield a powerful positive impact on your overall health. By ensuring your bedroom remains cool, you effectively decrease your risk of cardiovascular strain, promote deeper sleep, and wake up feeling significantly better, rested, free from the dangers of overheating. We now turn our attention to one final bedtime habit that poses a particular risk to seniors, yet it is something that many unknowingly practice every single night. This particular habit might come as a genuine surprise. The habit in question is sleeping in the wrong position. Most individuals give little thought to the way they sleep, assuming that as long as they feel comfortable, they are fine. However, after the age of 70, the sleeping position you adopt can have a far more significant impact on your health than you might initially realize. An incorrect sleeping posture can lead to breathing difficulties, impaired circulation, and even elevate the risk of heart failure or stroke. Despite this, a considerable number of seniors unknowingly position their bodies in ways that impose unnecessary strain on their systems night after night. The underlying reasons for this are critical. As we age, our bodies naturally experience changes in muscle tone, lung capacity, and the efficiency of our circulatory system. Remaining in an unfavorable position for hours at a time can restrict airflow, reduce oxygen levels in the body, and exert pressure on vital blood vessels, making it more challenging for your body to function optimally during sleep. Over time, these issues can contribute to a wide spectrum of problems, ranging from snoring and sleep apnea to more serious conditions such as nighttime cardiac strain. For instance, sleeping flat on your back, while seemingly comfortable for some, is actually one of the riskiest positions for many seniors. When you lie on your back, gravity causes your tongue and the soft tissues in your throat to relax and fall backward, which can partially obstruct your airway. This obstruction can lead to obstructive sleep apnea, a condition characterized by repeated pauses in breathing during sleep. Many individuals are unaware they suffer from this condition, yet it can significantly increase the risk of heart disease, high blood pressure, and even sudden cardiac arrest. Consider the case of Robert, a 76-year-old man who consistently slept on his back. His wife observed that he would sometimes stop breathing for brief periods during the night, followed by gasping for air. Initially, he dismissed these occurrences, attributing them to normal aging. However, over time, he began waking up feeling persistently exhausted, experiencing headaches, and struggling with concentration during the day. Upon finally consulting his doctor, he discovered that his sleeping position was a contributing factor to undiagnosed sleep apnea, placing a strain on his heart every night. Even if you do not suffer from diagnosed sleep apnea, adopting the wrong sleeping position can still negatively impact your circulation. Studies suggest that sleeping on your right side can place extra pressure on the heart, potentially hindering the efficient circulation of blood. This is particularly concerning for seniors with existing heart conditions, as it can contribute to fluid accumulation in the lungs and legs, leading to a condition known as congestive heart failure over time. So, what is considered the optimal sleeping position for individuals over 70? Experts generally recommend sleeping on your left side whenever feasible. This position is believed to enhance circulation, allow the heart to pump more efficiently, and even aid in digestion. For individuals prone to acid reflux or heartburn, sleeping on the left side can prevent stomach acid from migrating upwards into the esophagus, thereby reducing discomfort and improving sleep quality. If you find it challenging to maintain a side sleeping position throughout the night, consider using a body pillow to help prevent you from rolling onto your back. Elevating your head slightly with a supportive pillow can also be beneficial in keeping airways open and reducing the likelihood of breathing disruptions. Furthermore, if you experience joint pain or stiffness, placing a pillow between your knees can help maintain proper spinal alignment and alleviate pressure on your lower back. Making this simple adjustment to your sleeping posture can have a profound positive impact on your overall health. By ensuring your body is positioned optimally for circulation, respiration, and cardiac function, you can significantly reduce your risk of nighttime health complications and awaken feeling more rested and energized. If you are still following this video and finding the insights valuable, please indicate this by commenting number 4 below. Also, if you have not yet subscribed, we encourage you to do so and enable the notification bell so you don't miss any future videos. Your support is crucial in our ongoing efforts to create beneficial content that informs and inspires. In summation, we have explored 4 distinct bedtime habits that, while seemingly innocuous, can pose significant health risks for individuals over the age of 70. These range from consuming heavy meals too late in the evening to excessive fluid intake before bed, maintaining an overly warm bedroom environment, and adopting the wrong sleeping posture. Each of these practices can subtly but powerfully impact your cardiovascular health, the quality of your sleep, and your overall sense of well-being. The encouraging news is that these risks are not immutable. By implementing modest adjustments to your nighttime routine, you possess the capability to significantly enhance your sleep, mitigate your risk of serious health issues, and wake up feeling more robust each day. Now, take a moment to reflect. Do any of these habits resonate with your own nightly practices? Do you find yourself waking up frequently during the night? Have you experienced periods of restlessness or feeling overheated while sleeping? Perhaps you have been sleeping on your back for many years without fully comprehending its potential implications. Regardless of your current situation, the key lies in self-awareness. Once you identify a potential problem, you are empowered to take corrective action. Therefore, we present you with a challenge. Tonight, pay close attention to your bedtime routine. Try altering just one of these habits and observe the impact it has on your sleep. You might choose to move your last meal a little earlier, lower your thermostat, or consciously shift to your left side while sleeping. Even a single, small change can yield substantial positive results over time. Thank you for joining us today. We sincerely value your engagement and would be delighted to hear from you. Please leave a comment below and share one key takeaway from this video and how you intend to implement it in your life. Your thoughts are incredibly important to us, so please do not hesitate to share them. Reading your comments provides us with immense motivation and encouragement. If you found this video enjoyable and beneficial, kindly express your appreciation by liking, subscribing, and sharing it with others. Your support is vital for us to continue producing excellent content that informs and inspires. Thank you for watching, and we eagerly anticipate your presence in our next video.